Okay, so in this video, we'll talk about neurotransmitters and the associated um, neurological disorders and the most commonly used drugs to treat such conditions and the role these um, drugs play in terms of whether they act as agonists or antagonists. If you look at this table, the first column is about neurotransmitters. So the first one is GABA, norepinephrine, serotonin, and the second column is the disorder associated with this specific neurotransmitter. The third one is the commonly used chemical or the drug for that particular condition. And the last one is the way the chemical acts on the nervous system. You'll also notice in the neurotransmitter column that there is negative sign here. And in the next slide or so, you'll see positive sign. These signs indicate the abundance or lack of the specific neurotransmitters. A negative sign means that particular neurotransmitters, if it is deficient or less or unavailable to specific parts or the body or in the nervous system, it is associated with a specific disorder. Okay, I hope the organization of the table makes sense. Let's move on. This GABA neurotransmitter, decreased amount or decreased availability of this particular neurotransmitter is one of the factors of anxiety. And the common chemical that's used is the anti-anxiety medicine such as Valium. And the way this particular Valium works is it acts as a GABA agonist. Remember, the anxiety is because of lack of sufficient GABA. And what is this chemical doing is it's acting as an agonist, meaning it will increase the availability of the GABA. Because of the lack of it is the reason why there is anxiety in this particular situation. There are different ways agonists act as agonists. As we have seen, the main function of an agonist is to increase the availability of a specific neurotransmitter. They can either act as neurotransmitters themselves, or they can somehow increase specific neurotransmitters' presence in synaptic cleft. And then we'll talk about one such example here in a second. If you look at the second neurotransmitter, the norepinephrine, the decreased amount of it is often associated with depressive symptoms. And there are several antidepressants that are used in this situation where these antidepressants act as a norepinephrine agonist. Now, you'll also see depression associated with decreased amount of or lack of enough serotonin. In that situation, you use serotonin agonists to increase the availability of serotonin in the individual's nervous system. Now, here is the thing I was referring to. There are different ways agonists act as agonists. In this case, the specific situation where the depressive symptoms are because of lack of enough serotonin stimulation in the nervous system, a specific antidepressant called SSRI are used. What SSRI stands for is selective serotonin reuptake inhibitor. Now, if you remember that only few neurotransmitters in given synaptic cleft get docked or attached to the sensory the receptors on the postsynaptic neuron. And we said there are several things that may happen to the remaining neurotransmitters. They either get degenerated, or they get deactivated, or they are just vanish or move away. Or one of the things we discussed was that the presynaptic neuron can reuptake or reabsorb these things and recycle and send them back. Well, this What this antidepressant SSRI does is it inhibits the presynaptic neuron to reuptake, to take the serotonin back, so that there is more of serotonin in the synaptic cleft, resulting in more availability of serotonin, and thereby influencing positively, thereby um, uh, treating this condition temporarily, depression. So that's why it's called selective serotonin reuptake inhibitor, because it is inhibiting the reuptake or reabsorption of serotonin from the synapses. And again, in this table, you'll see the same format: neurotransmitters, its positive or negative sign, the disorder associated with the chemical often used in this condition, and the way it works. So here, dopamine, excess of dopamine results in schizophrenia, and often antipsychotic drugs are used. And to treat this condition, these antipsychotic drugs act as antagonists. Now, just to give you some information, the excess of dopamine in certain parts lead to schizophrenic typical symptoms, including hallucinations and delusions. So what antipsychotic drug does is it blocks, that's where it's antagonist, it blocks the dopamine receptors in the synapses, especially on the postsynaptic neuron, thereby making dopamine less available, right? And thereby decreasing those symptoms of hallucination and delusions drastically. And the opposite condition of this is decreased amount of dopamine, which results in Parkinson's disease. You have seen there is irregular movements of different muscles, and especially fine motor movements are lost in this individual. And the reason why we don't have chemical action here is that the main reason why, in most of the cases, the main reason why you see Parkinson's condition is not because um, there is dopamine and it is not available readily, but because the cells that produce dopamine in specific parts of the brain, they are they are dead, not making enough dopamine. So there are several other treatment measures, but the most specific drugs or chemicals that I could find to talk about. So that's why I left these open. Then acetylcholine is another neurotransmitter, and lack of it results in a condition called Alzheimer's disease. Again, this is just association. Decrease this often associated with Alzheimer's disease. Again, we're not talking in detail about these conditions. We just wanted to understand the relationship between neurotransmitters themselves and how they affect, depending on their excess or lack of it, some normal neurological functions in an individual, and if there is any chemical that psychiatrists use to correct the situation, and how that chemical specifically works. Now, one more last thing, just to give you some information about the specific actions of some of the important neurotransmitters that naturally occur in our body. For example, dopamine, we have seen increased or decreased amounts of dopamine in the system and lead to several disorders. But dopamine itself, naturally, its role here is several things, including giving a feeling of pleasure to an individual, and then a chemical equivalent, where these chemicals act as dopamine agonists, include such chemicals as amphetamine, cocaine, opiates, alcohol. And all these things mimic the action of dopamine, thereby acting as agonists and giving you pleasure feelings. No wonder why people get hooked onto these things. But here's the good news. There's another thing that actually gives a similar feeling of euphoria. Uh, um, and you don't need to go for these things because this is really good, right? Love. If you're in love, you can feel better. You don't need other things. Okay. So if you know somebody who's addicted, ask them to love somebody, and then be nice, and maybe that will help. Okay. Now coming to glutamate. The glutamate is a neurotransmitter. Its role is it increases the activity in your the nervous system. That's why if you see the caffeine is an example for a chemical that mimics a glutamate, and it increases the neural activity. That's why people take caffeine to be active, because then the nervous system is more active, more it acts as stimulant here. Then the last one is endorphins. These are called endorphins because these are endogenously available morphines in our body. These are the morphines that naturally our body produces, and these endorphins have often are associated with or lead to uh, act as painkillers, give us euphoric feeling of pleasure, and a general sense of well-being. And these endorphins are usually increased in our body when you do strenuous exercise, especially if you are a runner, and the feelings of pleasure and well-being after a long run are because of these endorphins. Now, chemical equivalents of these endorphins include morphine, heroin, and narcotics. Again, these chemicals act as endorphin agonists because they mimic the action of endorphins and give a similar feeling. Again, there are other ways to get these feelings. You don't need to go for these. Um, that's that's it in this video, and in the next video we'll talk about several other things, including brain and nervous system, and maybe before we get to another video, try to answer this question: what is an afferent neuron, and what is an efferent neuron? And we'll talk more about this in the next video. Thank you.